Where's Dr. Shufeldt when you need him? Speaking of Dr. Shufeldt, we're heading over to St. Joseph's Hospital with Dr. Shufeldt standing by to tell us about some very serious medical matters right after this. All during the show, we've been showing you a procedure that helps correct curved spines.
Yeah, we're going to try to get serious here for a second.
Yeah.
Dr. John Shufeldt is out of St. Joe's. Doctor, you're missing so much fun today.
You know, it looks like you guys are having a great time there, and I wasn't quite sure what you're doing to Brad's back, but if you did hurt it, here's how to fix it.
I kind of just want to take that whole segment back.
Yeah, I bet you do. Hey, we're here with two of Phoenix top docs, Dr. Alan Pitt and Dr. Philippe Albuquerque at Barrows Neurologic Institute. And one of the things we're talking about is osteoporosis and the resultant compression fractures that are related to osteoporosis. So, Dr. Pitt, why don't you go over vertebroplasty and how that's performed and what the indications are for it?
Sure, I'd be happy to. This is an MRI scan that someone with an acute compression fracture might have, and you can see this dark line here which indicates an acute compression fracture, and that's what we'd like to see before we treat anybody. The vertebroplasty itself is done as an outpatient procedure often. It's a fairly simple procedure where we just use a local anesthetic and a little bit of Valium-like medicine so that it's not too anxiety-producing. The procedure was developed in the mid-'80s and in France and has grown over to the U.S. Basically, we put a needle in the back, and you can see here would be the needle going in this, a model of the spine.
So this goes through the skin and then into this thing called the pedicle right here.
Correct.
And then through that, okay.
Absolutely. And this is a curved needle that we use so that we only have to do one stick. And it makes it quite simple and reduces the time of the procedure. So you can see that needle reaches all the way across the vertebral body, and we're able to put the cement in a controlled fashion. And we can see it under fluoroscopy. This big machine that's next to us lets us see the cement go in, and we use some very opaque, some very dense material so we can watch the cement go into the body. And the other images next to the MRI scan actually show after the procedure what we see, which is the cement in the vertebral body. And usually the patient has very significant pain relief almost immediately following the procedure.
So this white material right here for the viewers to see, that's actually the cement in the vertebral body, and it looks like the vertebral body has actually expanded a little bit or gotten a little taller.
We do see it expand just a little bit following vertebroplasty, and that's probably because when you're standing up, you're compressing down a mobile fracture. I tell my patients it's kind of like, would you be walking around on a ankle fracture or not? And you wouldn't want to do that. This is almost like putting a cast on a fracture.
Okay. It looks like we're seeing some video now of kyphoplasty. So Dr. Albuquerque, why don't you talk through this procedure? This is a little different.
This is slightly different. Basically, what we're doing here is using a slightly larger needle to go into the bone, and then through that needle we're inserting a balloon catheter that basically, once we've inflated it, somewhat restores the height of the vertebral body. And then through that, we basically proceed, as Dr. Pitt explained, with the injection of the cement. The balloon creates a somewhat larger space for us to inject the cement. And it's really a system that we can use in the lower lumbar vertebra, in the larger vertebra, where we can actually get access through a somewhat larger needle.
Very good. So this is for patients who have semi-acute compression fractures of their T-spine, which is the thoracic spine, and their L-spine, correct?
Right.
How quickly do they have to get in to see you all?
Well, we can treat patients up to months, but we want to see some evidence for marrow edema on the MRI or a bone scan. We don't use this for chronic compression fractures. We also don't use it for scoliosis. Patients have called and asked if we can use it for hip pain or knee pain. It's not indicated for that. It's really a specific procedure for a specific kind of back pain.
Great. So Marty and Scott, you can find out more about Dr. Pitt and Dr. Albuquerque on aztopdoc.com, which will have some links to both of them and to Barrows Neurologic Institute.
Yeah, we're looking at that website right now. It's www.aztopdocs.com. Can people, if they have TopDoc.com, excuse me. If people have questions, can they email on that website as well?
They can email, but they can also call the number there, and they'll fill out a questionnaire, have a questionnaire go over with them to see if they're actually candidates for this procedure.
Okay.
In fact, in our next segment, we're going to interview a patient who had this procedure done here at Barrows and talk to her about her success story.
Yeah, that'll be interesting.
Is that doctor's name really Dr. Albuquerque?
Dr. Albuquerque.
Here's what I learned living in Albuquerque for a year. A-L-B-U-Q-U-E or Q-U-E.
And you spelled it correctly.
Thank you very much.
There's no end to your talent. Thank you very much. We'll listen for that patient towards the end of the show.
Thanks.
And the phone number he was referring to is on our hotline. Before we let things get too out of control, we want to be serious for a moment and talk to Dr. John Shufeldt out at St. Joseph's Hospital, talking about a very important procedure to correct curved spines.
Hey, Marty and Scott, how are you? It's actually more to correct spinal fractures for people with osteoporosis, and you all look like you're having way too much fun back there. We are actually back with Mrs. Mines, who had this actual procedure done. How long ago?
About a year ago.
About a year ago. Now, as I understand it, you were volunteering at the Symphony, and you were going to help somebody who was handicapped, and then you actually fell. What happened after that?
Well, after that, I was brought by ambulance to another facility, and they took an x-ray and it decided that there wasn't anything, and they sent me home. And I was home for 2 days with extreme pain. The pain was terrible. And finally, I called my internist, and he said, go over to St. Joe's. And going through the emergency room, which I did, and there it was determined with x-ray and MRI that I had a fracture, compression fracture, and I was admitted to the hospital. The following day, Dr. Pitt came in. He happened to have been in the hospital that day, and he described the procedure. And my husband was visiting, and we discussed it, and we decided to go ahead with it.
Now, how much pain were you in right then? Because you said you were at home for about 2 days.
An extreme pain. It was so bad that I just couldn't take it anymore, and I realized there had to be something more wrong with me than what I was told.
Could you even walk?
I could not walk. I could not move. I could not walk. I couldn't get up from a seat or a chair, and it was just a terrible situation. Something had to be done.
Okay, so tell me about the procedure.
The procedure was painless, and it was done very quickly, actually. It seemed that way to me. And I was brought back to my room. The next morning, I was discharged from the hospital. Actually, just before I was discharged, I tried to go to the bathroom and see if I could do it on my own without getting help. And sure enough, I was able to get to the bathroom by myself. Then, shortly thereafter, in the afternoon, I was sent home, and things began to get better as time went on. It wasn't very long before I was able to get around and start walking, and I am very fortunate because I can now walk very well. I can stand, I can do all my work that I need to do at the house, and I can participate in all the activities that I love to do.
Great. Back at the Symphony, I bet.
Not really.
Not quite yet. So, Dr. Pitt, how long would she, if she didn't have this procedure done, how long would she have been bedridden for? What's it, 6 to 8 weeks?
You can't really predict, but it would often be 6 to 8 week period of time that certainly limited mobility. People wear these corsets that they try to help to mobilize earlier. Not very well tolerated, but it would often be a period of weeks, and sometimes that doesn't work at all, and you unfortunately end up with some sort of complication, and that's what we're really trying to. Right. Also, the bone will tend to compress further over time, and you can be left with some further deformity. You've kind of seen this kind of humped over look.
Right, the widow's hump.
Yes, exactly, widow's hump. Older women tend to get, and that's actually a series of compression fractures with the volume loss, the height loss of the vertebral bodies.
That's amazing. So Marty and Scott, really truly kind of revolutionary treatment here. It's been going on in France for about 10 years. They've been doing it here at Barrows for
about 3 years now.
About 3 years. And, you know, for us in the emergency department, seeing these patients just come in absolutely misery and now having something, someplace to send them so they can actually get some help is really remarkable.
Very cool, John. Thank you so much.
Thank you. And you can check them out at daisytopdoc.com.
All right.
Thanks.
We're going to put up the website right now. There it is.
Perfect.
daisytopdoc.com.
Thank you, John.
And we'll catch you next time. Thank you.